Welcome to my YouTube channel. Please like, comment, and subscribe. Hypothermia in maritime work. If you work aboard a vessel that plies ocean waters, you are at risk for developing hypothermia, a dangerous condition in which body temperature drops below 95 degrees. Maritime workers are at a greater risk than a worker in most other types of industry of developing hypothermia. Cold working conditions along with the risk of the falling overboard into cold waters mean that seamen are often in danger of becoming hypothermia on the job. And then next, what is hypothermia? Hypothermia is a lower body temperature. Normal body temperature is 90 degrees and anything less than 95 degrees is considered hypothermia. Exposure to cold air and cold weather and being immersed in cold water are the main causes of hypothermia. Depending on the air or water temperature, the time it takes to reach a state of hypothermia varies. Mild hypothermia, which includes having a body temperature around 95 degrees, is characterized by shivering, fast breathing, fatigue, difficulty speaking, hungers, dizziness, and increased heart rate or confusion. Moderate to severe hypothermia with a body temperature of 95 degrees or lower can cause shivering to stop, which may be confusing. Symptoms of moderate to severe hypothermia include slurred speech, confusion, drowsiness, shallow breathing, a brief pulse, and loss of consciousness. Hypothermia can be very serious and if not treated, can be fatal or may cause other complications. This may include frostbite, the freezing of tissue in the body. If frostbite goes untreated, it can lead to the death and decay of tissues or gangrenes. Gangrenous tissue typically need to be amputated. And then next, treating hypothermia. The main goal of treating hypothermia is to bring the body temperature up to normal. If you suspect you are suffering from hypothermia on the job, you need to seek treatment immediately. First aid care for hypothermia includes getting to a warm place and using covering and heat sources to warm the body. If you are suffering from hypothermia from a fall overboard, you will need to remove your wet clothing in order to get warmer. Warm compresses, blankets, and warm beverages can all help to elevate the body temperature. If you have access to medical professionals and the proper equipment for treatment, there are medical procedures that can be used to treat hypothermia. These include blood rewarming or withdrawings and warming blood and then recirculating it through the body. Oxygen can also be used to rewarm the airways and warm intravenous fluid may be injected to warm the body. And then next, preventing hypothermia in maritime conditions. Seamen are more at risk for hypothermia than workers in other industries, but this condition can be prevented with proper precaution. The first is good safety training. Your employer should provide workers with training in both preventing hypothermia and in giving first aid for this condition. You should also be provided with the correct protective gear for the condition in which you work and with plenty of break time to warm up periodically during a shift. If falling overboard is a risk, you should be provided with a whistle so you can be located and rescued quickly. And then next, negligence and hypothermia. Maritime work is inherently dangerous and hypothermia is easier to get than you may think in spite of the risks. Your employer has the responsibility to take all reasonable measures to prevent hypothermia in employees. Any failure to provide safety training, education about hypothermia, first aid training, safety and protective gear, or rescue training for falls overboard could be considered negligence if you develop thermia on the job. And then next, hypothermia and your rights. Hypothermia may be mild and if treated immediately may cause no lasting damage. However, hypothermia can be fatal if severe and untreated. It can cause lasting damage in the form of frostbite and amputation. If you have to miss any work because of hypothermia, pay for medical treatment, or suffer lasting damage, you are entitled to compensation. Various maritime laws are in place to ensure this. Maintain and cure entitles you to medical treatment as well as living expenses for the time period when you cannot work due to your illness or injury. If you are qualified as a seaman and your employer's negligence caused you to develop hypothermia, the Jonas X can help you get compensation for lost wages, medical expenses, future lost ability to earn wages, and for pain and suffering. There are also federal workers' compensation programs for non-seamen working in the maritime industry. Thank you for watching this video. Don't forget to give like, comment, and subscribe.